The World Health Organization on Saturday declared the international monkeypox outbreak a global emergency, a decision that underscores concerns about rapidly spreading infections sparked by the virus. According to the WHO, the move to label the outbreak a public health emergency of international concern, PHEIC, is to trigger a coordinated international response which could unlock funding to collaborate on sharing vaccines, treatments, and to pressure governments into action.
As of today, more than 16,500 cases of monkeypox have been reported in 74 countries. The WHO Director General Tedros Ghebreyesus has described the outbreak as one which is concentrated among men who have sex with men, especially those with multiple sexual partners. Officials say the global risk of monkeypox is moderate, but it is high, rather, in Europe, where most of the infections have been recorded.
As it stands, the world is confronted by two viral diseases that have crossed the extraordinary threshold of being declared health emergencies: the COVID-19 virus and now monkeypox. I think it's an important move for the WHO to declare it a global health emergency, because what we see that happened to us in, as regards COVID-19 was that probably we're not quick to start to combat it. We're not quick to respond to COVID-19 as we should have. A lot of the countries were still thinking, oh, it's not gotten to me, it hasn't got out. These are visual, the pictures we just showed you, a visual representation of what it looks like to have monkeypox. It looks like an aggravated form of, on the skin. I mean, there are lesions on the skin. It's fatal. There are lots of people who have passed from it. We must be prepared. We shouldn't wait until it's very close, like where you can see, out of 5 people, 1 person has monkeypox. A lot of countries waited to the very last minute before response to COVID-19, came up.
Yeah,
so,
I agree. But I think since we are still dealing with COVID, and I'm sure there's a couple of mistakes here and there that the world made with COVID, like you mentioned. So it's not too. It's good timing for us to start to do better with regard to monkeypox, and hope that it doesn't develop into a bigger problem. I also think that the WHO Director General Ghebreyesus and Anthony Fauci, the U.S. Health, top health guy, they need to also be clear, what exactly they mean by it's gotten mostly by men who have sex with men. I need to understand exactly. The world needs to understand, or they need to clarify, so it's not misinterpreted, as a sexually transmitted, infection. And people need to understand that better, because when they put that out, it takes your mind to a total different place entirely. And I've heard, Anthony Fauci say that. I've also now just read, that Dr. Ghebreyesus is also saying the same thing. So they need to either stop, stop using those ways of describing monkeypox, or just to let the world be sure exactly.
Because then people who are, heterosexual people will then say that, oh, that means I don't need to be careful.
Exactly.
It's only people who are.
We just need to be careful with the messaging, because that's one of the things that we had, the issues that we have with COVID, vaccinations and the need for, double dose, the need for booster dose. There was so many bits of misinformation.
Even before we got to the vaccines, did you forget the time when, as soon as COVID-19 became a pandemic, people were bathing in salt, people were doing a lot of things. There's so many speculations, taking herbs to probably prevent COVID-19, which, ended very badly for a lot of them.
Yes, it did.